It sounded like a lot like our game.
We'll begin with the Pledge of Allegiance. Yeah. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the October 29th, 2018 meeting for the Shawnee County Board of Commissioners. My name is Kevin Cook, as I serve as the chair of the Shawnee County Commission. Joining me today is Commissioner Shelley Bueller. Good morning.
Good morning.
Commissioner Bob Archer. Good morning.
Good morning.
Well, glad we're all here. And Commissioner Archer, you sound a little under the weather, so we'll try and keep it light on you today.
Thank you, Mr. Chair. I appreciate any consideration you can give.
Just a little. Madam Clerk, our first item.
Our first item is item 3, consent agenda.
The district attorney has asked that we pull this item for some revisions, and so I would, at this time, move to pull item 1 from the consent agenda.
Second.
Motion made by Commissioner Cook, second by Commissioner Archer. All in favor say aye. All opposed? Passes 3-0. Our next item.
Item 4, new business A, County Clerk number 1, consider all voucher payments.
Vouchers are totaling $995,468.54. Under sales tax, we have a total amount of $254,249.60, and that is for to Terrell and Karst Architects for the Expo Park B, and $3,440 for the Expo boiler. For information technology, we have a good bit of that for V-block maintenance, totaling $112,199.47. And then we also have solid waste and recycling and enterprise fund. Non-tax dollars, $189,383.92. So if there are no questions, I'll move approval.
Motion for approval by Commissioner Bueller.
Second.
Second by Commissioner Archer. All in favor say aye. All opposed? Passes 3-0. Our next item.
There are no correction orders today, and just for your information, we're working on the new tax roll, so this is that kind of that time frame that until we get the new tax roll, we won't have any correction orders because we don't want to make any changes to anything until everybody gets their taxes.
Yeah.
And we're doing our best.
Great. Our next item.
Item B, Parks and Recreation. Number 1, consider approval of a request for a project budget of $53,715 and a sole source purchase from Easy Dock for replacement of Lake Shawnee floating dock, in addition to the South Boat Ramp dock for ADA kayak and canoe launch, with funding from excess funding.
Good morning, Commissioners. John Boyd, Parks and Rec. We're requesting approval to replace these docks. They needed some upgrades. They're in pretty bad shape. And also the second part of that project is to add ADA access for canoeing and kayaking.
Okay. During the renovations of the Lake Shawnee, or the rebranding of Adventure Cove, we had some discussion about where the docks are at, the boats are at, and is this part of that change, or is this keeping the docks where they are currently at?
This is replacing existing docks. This is at the other end of the lake, so yeah, this is a different part of that.
Okay. And then I know that I have been contacted by veterans on the water that do work through veterans for ADA compliance for kayaks as part of their outreach, as part of a therapeutic outreach. I didn't know if they had been in touch with you as well.
We've had several meetings with them, and once this goes through, yes, we're hoping to be able to bring them in for some fundraising to work with us on this. But yes, we have been in contact with, actually it was Heroes on the Water.
Heroes on the Water, yes.
Yeah.
It's part of, again, as a therapeutic activity for PTSD and other actions, and so I think the things that we can do for our veterans where we have those partnerships would be good for the community.
Absolutely. From what I understand, they come out once a month and host fishing events, and they grill burgers and hot dogs and things like that, and have a day for veterans. It's quite a good project.
The funding source from this, it says excess funding. Would that specifically be the money from the reserves that we allocated for deferred maintenance?
I believe so, At this point in time?
No, it's not.
So perhaps,
Betty Greiner, Director of Administrative Services. Yes, this, what they're referring to as excess funding is part of that $3 million from the reserves that you designated for Parks and Rec deferred maintenance.
okay. Questions?
It was my understanding that was COP from 2015, Betty. Is that not the excess funding? I guess I was misunderstanding.
I believe what they're referring to as excess funding is the money from the reserves.
Which is,
Is that right, Randy?
That's the way I understand
but that's for maintenance,
It was designated for deferred maintenance.
and this is actually new equipment.
Well, it's part of it is replacing a dock. So if it makes more sense to replace an old dock than to, than to fix it, then that would be considered deferred maintenance if it's replacing an old dock that is no longer in use or viable, yeah. Now, I don't know about I don't know if adding the new part of the dock would fall under that or not. Is that a new extension, or is that part of the total dock replacement?
It's actually an addition to the existing dock facilities, and we are exploring other options for funding as well with the foundation and Heroes on the Water as well.
I think there's some confusion, Mr. Chair. Could we defer this item for 1 week until I have an opportunity to discuss it with John Knight and with Betty? I'm still confused about what the excess funding is. I don't know if, I was thinking it was COP money, and you're telling me it's deferred maintenance money, but we're actually adding on new facilities. So I think it's kind of hazy and questionable whether that really falls into that category. So I'll make a motion to defer for a week until I have an opportunity to look at it, discuss it with Betty and John Knight, if that's okay, Mr. Chair.
John, is there anything that's time sensitive as to this that would need?
No, not at this point in time. That'd give us some more opportunity to have some meetings with the foundation and Heroes on the Water as well.
Okay.
Okay, that's fine.
Motion made by Commissioner Archer to defer 1 week. That takes us to November the 5th. Is there a second?
Second.
Motion made by Commissioner Archer, second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. We will take this back up on November the 5th.
Thank you.
Thank you.
Thank you, Mr. Chair.
Our next item.
Item C, Health Department, number 1, consider authorization and execution of contract C347-2018 with the Michigan Public Health Institute and contract C348-2018 Business Associate Agreement, allowing the Health Department Fetal Infant Mortality Review Program staff access into the Fatality Review Case Reporting System to be used by the FIMR program for a period from July 1, 2018 through December 31, 2020, with no cost to the county.
Good morning, Commissioners. Teresa Fisher with the Health Department. Before you today is a request to enter into a contract with the Michigan Public Health Institute. This particular contract would allow us access into their case reporting system, which would be used for our fetal infant mortality review program for our staff. I'd like to take just a few minutes to review what Femur is here in our community and some of the things that we've been working on. And hopefully everything works good. So just as a reminder, we received our grant for our Femur funding back in 2013. That's not when our record reviews started. Those didn't start until 2015, but we used those first couple of years to organize staff, write policies and procedures, and really learn more about the Femur program. So as a reminder about how infant mortality is defined, this is the death of a child less than 1 year old here in our community. This also refers to stillbirths or fetal death after 20 weeks gestation. That's things that we review. And the infant mortality rate is how it's determined is the number of deaths of children less than 1 year of age per 1,000 live births. So to be eligible for Femur, they go through the testing at KDHE to determine if the case is eligible, and then it's sent on to us for review. We don't review anything with any legal litigation. So a little bit of data, the most recent data that's out from KDHE for our community, From 2012 to 2016, our infant mortality rate was 6.6. Right now, I believe that Healthy People 2020 goal is 6.0, so you see we still have some work to do. We had 76 infant deaths during those 5 years, and we're one of 4 counties that make up the highest number of infant deaths. The other 3 counties are Sedgwick, Johnson, and Wyandotte. And of course, we're the bigger counties, so we also have a higher birth rate. But together, we account for just over 50% of all the Kansas deaths, these 4 counties do. And then we account approximately for 6.3% of the total deaths here in our state. And again, KDHE uses the 5-year rolling average just so that things level out and it's more statistically sound. So a little bit about the Femur program in general. Back in '84 is when it was initially developed. It came out of the Maternal Child Health Bureau and HRSA, the Health Resources and Services Administration. It started with just 6 Femur projects here in the U.S., and now there's, I just looked last week, and there's over 170 here in the U.S. Throughout 29 different states. Kansas does have 4. Sedgwick County started our programs here in Kansas and really led to a lot of the legislative change that needed to happen for Femur to be able to take place. But there's ours, Geary County and Wyandotte County also have Femur programs. So the Femur reporting system, this is really what the contract is about today. We used to utilize a program called Bassinet. It was developed by Go Beyond, and it was a locally owned business initially in Florida. And when we received our grant and contract, that's who the contract was through, and they provided the database service for all 3 of the Femur counties that came on board at the time for us in Wyandotte County. Well, that program and company actually closed up business late this summer. And so we, right now, are currently without a database that we need to be able to use. And so the National Center for Fatality Review and Prevention is who has really taken over Femur at the national level. The American College of Obstetrics and Gynecology initially did a lot of work with it, and they've kind of shifted their focus. So this National CFRP group is collectively at the nation level working on the Child Death Review Board and the Fetal Infant Mortality Review projects. And so they have combined and came to work and produced this case reporting system, and it's at no cost to any Femur project or Child Death Review Board here in the U.S. That was part of their goal, and that's what their funding, part of the funding that they receive goes for. And so they work closely they don't work closely. Over 40 states is who is currently using it, and it's really considered the norm now for Femur programs to use. And I can tell you that Geary County and Wyandotte County are also on it right now. So the Femur process in general, this looks familiar to a lot of us as far as the quality improvement cycle. We have a case review team that reviews these cases. This team is by invitation only. It's a great board here in our community. We've got a lot from the medical community. We've got OB doctors, we've got pediatricians, we've got NICU workers, we've got social workers, we've had our coroner, hopefully we'll have our new coroner. We've got our health officer, we've got a pastor, mental health. So lots and lots of great representation on that board that review these cases, typically on a monthly basis. So some of the things that we've learned over the past few years, one of the projects that the community action team, which you'll see is the next group after the case review team, what their job is to take the recommendations made by the case review team and to try and implement those here in our community. So one of the things that they did was work on getting postpartum appointments scheduled. We learned that women that deliver in the hospital and there's either a stillbirth or their baby passes away before they're discharged, we're not returning for their postpartum appointments. And of course, that's a really important appointment for those women to be at. So both the delivering facilities, the community action team has worked with them, and those appointments are now being scheduled prior to those women being discharged from the hospital so that they don't have to make that tough phone call. Instead, they just get a reminder call of when their appointment is. We also learned that mental health is playing a huge role here in our community, which is probably not a surprise to most of us with the last community health assessment. So a large percentage of the cases that we've reviewed over the years have either had a history of mental health or a current history of mental health, and that's separate from substance abuse. So things that the community action team right now is working on, they're looking at other places for women to be screened both during their pregnancy and postpartum period for opportunities to be able to help them access mental health and get them services services they might need. And the group is also right now working on trying to get a postpartum support group started up. We have an infant loss group here in our community, but we don't currently have a postpartum depression support group. And so the group is working to start that up. And then just looking at overall the mental health system and exploring options to be able to get women into services in a more expedient manner, knowing that if they're pregnant or newly delivered, we don't want them to have to wait 6 or 8 weeks to get services. Family planning has also come up. We know that some of the cases we reviewed were unplanned or unintended pregnancies. And so the group has developed an informational flyer that lists out different options here in our community about what women can access, what different options might be available at the various places, and the cost associated with those. And then safe sleep. Particularly last year, some of the cases we reviewed, safe sleep came up more times than what we hoped to see. And so we will be looking at what educational opportunities we can embed safe sleep. We know that the Back to Sleep campaign from the 90s did a great job, but we know we have more work to do if we're still seeing unsafe sleep environments. And so one of those that we do annually, and it's coming up this coming Saturday, is our community baby shower for safe sleep. And that's an opportunity for women to come, not only learn about safe sleep, but they learn about community resources here in our community. And based upon donations, and while supplies last, they'll also leave with a free portable crib and a wearable blanket this year. And in addition, we're also partnering with the immunization department, with the health department, and offering Tdap shots this year. So we're hosting that this year in hopes to get more women the safe sleep information that they need. And with that, that's a little bit about our Femur project and things that we learned, and I'd be happy to answer any questions you might have.
Questions?
No questions. Thank you for the overview.
Absolutely, good information. Is there a motion then to authorize an execution of the contract?
So moved.
I'll second.
Motion made by Commissioner Archer, second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. Thank you very much. Our next item.
Item D, facilities maintenance. Number 1, consider approval of request to waive the purchasing policy and approve an expenditure of $13,744 to Senni Construction for a series of improvements to the second floor of the North Annex necessary to facilitate the move of solid waste from the first floor with funding from the solid waste operating budget.
Good morning, Commissioners. Bill Kroll, Facilities Maintenance Director. This item came up essentially because of poor communication between Tom Vlock and myself. It's a failure on my part to make sure that I didn't manage that project, or at least we had one manager of this particular project. It shouldn't have happened. I assumed Tom was doing some things. He was assuming I was doing some things, and it was to facilitate the move of solid waste up to the second floor. Be happy to answer any questions that you have on it.
Bill, this was part of a project that was authorized to try and get the solid waste all consolidated with Public Works.
Yes, upstairs.
And so the reality is the project just went a little bit bigger than what we had originally authorized, and it is being paid for under
solid waste funds,
not taxpayer funds.
That's correct.
Okay. Questions, Commissioners? All right. We need to make sure that we keep a close eye and that this would not happen in the future.
Yep.
So,
Agreed.
motion for approval by Commissioner Bueller.
Second.
Second by Commissioner Archer. All in favor say aye. All opposed? Passes 3-0.
Thank you.
Our next item.
Item E, Sheriff's Office. Number 1, acknowledge receipt of correspondence from Sheriff Jones regarding his intent to solicit proposals for a storm shelter at the BARDA Training Complex funded through a special project fund.
Good morning, Commissioners. Captain Hubler with the Sheriff's Office. This is a project we've been contemplating working on for a little over a year now. We host hundreds of training opportunities and events at the training complex every year. A lot of those are outside agencies, et cetera. We have looked into a storm shelter. Don't want to excavate because we're just on a long-term lease there. So we looked at above-ground storm shelters, and this seemed like the best way to go about it. I'm not an expert in above-ground storm shelters, and don't know that I could find anybody that really is. I talked to several different vendors, all of them claiming to be that they could sole source their product, but I figured the best way to go about it was to find a product that was the size that we needed and would also meet the requirements that we had. So we'd like to go out for RFP.
When the BARDA training facility was first opened, it was touted as being paid for through the forfeiture funds. It was completely supported by the forfeiture funds, and that it's continued in that way really since that point. And, I mean, that's, you know, the idea was that the criminals are basically paying for the training of the officers. Is that still what we're planning on looking at for our funding sources, through forfeiture funds, or what is our funding source?
So the funding source for this is a special project that the commissioners authorized last year with, or earlier this year, with funds from 2017 monies to not only put a storm shelter at the training complex, but also to try and get high-speed internet out there. I'm still working with IT because of its remote location. High-speed internet's a little bit more problematic to get out there, but that is the funding source that we plan on using, the special project fund.
Okay. Questions?
And this would meet all building codes, all, have you researched that?
We have spoken with MTAA, which is where most of our requirements are coming from.
Okay.
And that is also one of the requirements of the RFP, that once we get those, then we will confirm that it does meet with all the building codes and requirements of our lease.
Okay.
You said the lease term is limited. Could you describe that a little bit?
I really can't speak to that because I don't have it in front of me. I have read it more than once, but the specifics, there's a height requirements as far as how high we can go because it's on the base, and I believe there's some excavation limitations, but without having that right in front of me, I can't speak specifically to that.
But you don't know what the term ends, when the term ends?
I do not remember the end of the term date at this time.
Okay. Thank you, Mr. Chair. I'll acknowledge receipt.
Motion to acknowledge receipt by Commissioner Archer.
A second.
Second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. Thank you.
Thank you.
Our next item.
Item F, Public Works Solid Waste. Number 1, consider approval of a request for a project budget for the reconstruction of Southwest Gary Ormsby Drive from U.S. Highway 75 northbound on-ramp through the intersection with Southwest Innovation Parkways. The City of Topeka will contract with an engineer for design, and the county will bid the project, hire the contractors, and will pay 50%, or $500,813, whichever is less of the final project cost, with funding from the Public Works Special Highway Improvement Account.
Good morning, Commissioners. Tom Flanagan, Public Works. Yes, this will be the reconstruction of Gary Ormsby Drive between the off-ramp, the on-ramp to 75 Highway, east over to Innovation Parkway. It'll be a joint project. We'll work with the City of Topeka. They're in the process of preparing the plans. Once those plans are done, we'll take those plans, we'll take them to letting, and we'll take the project to construction. And our agreement that we have with the City of Topeka fixes our cost not to exceed $500,813, or if the project comes in, we pay less. Be happy to answer any questions you might have.
Tom, do we know the status of the plan design with the city?
Yes, we're past field check. We're close to office check stage, so I'm saying we're 80%.
Okay. I know that this is a pretty big deal for everybody that travels on Gary Ormsby Drive, as the trucks and just general concern of the safety of the roadway, and trying to get this addressed as quickly as possible.
Correct. Now, I might add to that. One of the things that's going to happen, we will probably bid this, anticipate bidding this in January or February, but we will probably start construction in March. We need to have warm weather. A couple of weeks ago, you folks approved a change order for the Expo Center to have Terracon do some research on how to rebuild that pavement in the parking lot. This is the same kind of a design that we're going to try to do out there. It'll be a Portland cement stabilized base. So we need temperatures.
So we'll see how it goes for Gary Ormsby Drive before we get into it for the Expo Center, I suppose.
Yes, sir.
All right. Well, I think we'll do everything we can to try and order up some warm weather.
Commissioner
Bueller, that's your task.
I'll move for approval.
Motion for approval by Commissioner Bueller.
Second.
Second by Commissioner Archer. All in favor say aye. All opposed. Passes 3-0. Our next item.
Item F2, Consider approval of a request for a project budget of $484,010 for the removal and replacement of the Sherwood Wastewater Regional Sewer District Pumping Station Number 60, which has failed and needs to be replaced to prevent possible environmental and public safety concerns, with funding from the Sherwood Regional Wastewater Sewer District.
Tom Flanagan, Public Works. Commissioners, yes, pump station number 60 at Sherwood has failed. It's currently being sustained by the city of Topeka by putting in a single pump, and we're just trying to keep the station moving along until we can get this thing under construction, get it replaced. We don't want to have it completely failed. If it does, we have to go to what they call bypass pumping, and that could cost us a significant amount of money to be able to bypass around the station. And again, the funding for this is out of the Sherwood account.
Any questions for Tom regarding this?
Move to approve the request.
Second.
Motion to approve by Commissioner Archer, second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. Our next item.
Item F3, consider approval of a request to award the bid to Jetstream Equipment Company for 5 hot water pressure washers with trade-in allowance for 4 Hot C 79 5SS and 1 Alcata hot water pressure. Can you just come up with names that are little? Resulting in a total price of $23,400, with funding from the 2018 Public Works Special Machinery account.
Tom Flanagan, Public Works again. This is, we received one bid from Jetstream Equipment for the 5 hot water washers, and the trade-ins at a cost of $23,400, and it will be funded from the Public Works Special Machinery account.
Any questions? I'll move approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. And with that, Tom, you're now being demoted back to interim. Is this your last appearance as the, I guess, your Assistant Public Works Director from interim?
Yeah, I believe so.
So thank you very much for your serving in that capacity as interim. You did a great job, and we look forward to, I understand our new Public Works Director is going through orientation today.
Yes, and I'm hoping he has a quick learning curve.
Well, with you as his assistant, I'm sure he will.
Thanks, Tom.
What a smile.
I know, he looks pretty happy.
Yeah.
Our next item.
Item G, County Councilor, number 1, consider approval of the following resolutions. Number 1, resolution number 2018-55, appointing Ransom Ellis, D.O., to serve as the district coroner for the 3rd Judicial District for a term ending January 12th, 2020. B, resolution number 2018-56, appointing Louis P. Kreider II and Jennifer McCollum to serve as deputy district coroners for the 3rd Judicial District at a 1-year term ending October 28th, 2019. And C, resolution number 2018-57, appointing Charles Glenn, M.D., to serve as deputy district coroner for the 3rd Judicial District for a term ending November 15th, 2018.
Thank you, Cindy. Good morning, Commissioners. Jim Krause, Shawnee County Councilor. These are interrelated resolutions to appoint a new district coroner. This process started last September, a little over a month ago, when we received notice that Dr. Charles Glenn was going to resign as district coroner effective November 15th. You directed me to contact Forensic Medical Holdings to find us a suitable replacement as district coroner. They initiated their search, and they have recommended Dr. Ransom Ellis as Dr. Glenn's replacement. Dr. Ellis is here. Dr. Glenn is here. I'd like to introduce Dr. Ellis to come up and give us some information about his background, but just to wrap up what these resolutions are, they are, number 1, to replace Dr. Glenn as district coroner, to appoint Louis Kreider and Jennifer McCollum as special deputy coroners in order to go ahead and be authorized to sign certain paperwork that becomes necessary from time to time in the office to allow the office to act promptly on various administrative duties that they do have, and then finally to reappoint Dr. Glenn as a deputy for the remaining amount of his term before he resigns, so that he can complete his work before he leaves us.
Before you leave, would it be your pleasure to have these approved as single items or approved as a whole?
Well, I would definitely, the final two are contingent on approving the first one. So let's approve the first one, and then let's do them as singles in order.
All right, before we get to that, if we could have Dr. Ellis come up and introduce yourself a little bit.
Good morning, Commissioners. My name is Dr. Ransom Ellis. I'm a forensic pathologist at Frontier Forensics Midwest in Kansas City, and I started working there in June of 2018, and am looking forward to serving the people and everybody here in Shawnee County.
Okay.
So,
if you could, just tell us a little bit about your background, degrees, certifications, where you come from.
yes, sir. So I grew up in Springfield, Missouri, went to undergraduate at Drury University, and then came up to Kansas City for medical school training at the University of Kansas, and then followed up with anatomic and clinical pathology residency there. And my forensic fellowship was at Jackson County Medical Examiner's Office in Jackson County, Missouri.
Questions for Dr. Ellis?
Do not have any, thank you.
All right, thank you.
Thank you. Any questions? I do know Dr. Glenn is at the back of the room. Just do want to, thank Dr. Glenn for your service that you have given to Shawnee County. Wish you the best of luck in New Zealand. I don't know that you could get any farther from Topeka. It's the opposite side of the world. So, I would make a motion then to approve Resolution 2018-55.
Second.
Motion made by Commissioner Cook, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Is there a motion as to the 2018-56?
So moved.
Motion
Second.
made by Commissioner Archer, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. And then as to 2018-57.
Move to it.
Go ahead.
I was just going to say, move to adopt the resolution.
Second.
Motion to adopt the resolution by Commissioner Archer, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0.
Thank you.
Thank you. And thank you to all involved. Our next item.
Item H, Commission Number 1, consider approval of Resolution Number 2018-58, allocating the 2019 social service funds, service programs for the elderly funds, and the special alcohol drug programs funds.
Okay. Commissioners, this has come to us for approval. There is a breakdown of the allocation of the $226,793 to the different agencies. I don't know if there's any comment or questions about it. If there's any agency that wants to speak as to it or offer any input while you're here. Seeing none. Yes, please.
I'm not with social services, but I'm with the Alcohol Drug Council,
Yes.
of which there was 45,000 available this year. I'm Max Wilson, I'm sorry. I'm sorry, I'm Max Wilson. I'm the chairman of the Alcohol Drug Council's Grant Review Committee. 45,000 is proposed for 2019. That's 5,000 less than this year. So you need to go out and outside of the county, have dinner and have some wine or alcohol with that, and that'll build up our, and if you need a designated driver, you can always call me. I'm in the phone book if you can find the phone book. The programs we're recommending is Vallejo Recovery Center Social Detoxification Program, and this has been a lifesaver. I've been hauling people to social detox for something like 30 years, and it's a lifesaver. Take people there that are shaking and about to go into DTs and all manner of mental and physical problems, and they take care of them there and save us a ton of money in terms of emergency room services. They get them stabilized where they're down, then after they're stabilized, then they go on to treatment and be successful. We're asking for $25,708 for this program for 2019. The PARS, Prevention and Recovery Services Evaluation Intervention Program, familiarly known as the Youth Evaluation Program, has been around for many years, and it provides free services to youth and families, and also adults who need interventions and who need assessments and referrals. We're asking for $6,602 for that program. And then the 3rd Judicial District's Drug Court, it's a specialty program that combines problem-solving court sessions, community supervision, and treatment into a public health approach toward helping substance-using offenders. We're asking $12,690, and all those dollars go to pay for treatment. The staffing of that is paid for with state funds, and all money from this fund goes to pay treatment providers. Any questions?
I don't. Thank you very much, Max. And I thank you for pointing out that this resolution not just covers the social service agencies of the $226,793. It also includes the special alcohol drug programs of the $45,000 that you described. In addition, it also makes allocation to the service program for the elderly of $694,536. And so, again, there are 3 components to this resolution, and just noting those 3 components.
Okay.
Thank you very much,
Thank
Max.
you.
Are there any other individuals wanting to speak on this resolution? Seeing none, is there a motion?
So moved.
Motion made by Commissioner Bueller for its
Second.
approval.
Second.
Second by Commissioner Archer. All in favor, say aye. All opposed? Passes 3-0. Our next item.
Item 5, Administrative Communications.
This is an opportunity for any member of the public or department head to address the commission on any item.
Good morning, Commissioners. Randy Luby, Parks and Recreation. Just a quick reminder, this afternoon at 2:30 at Lake Shawnee Junior, we are having a ribbon cutting of reopening Lake Shawnee Junior, and we'll be renaming it at that time. At that time, it will become the Hanger Family Fishing Pond, and I'm real excited over this project. It's a project that our foundation and the county both work together in a partnership for the renovations of Lake Shawnee Junior, and invite you all to come out today and enjoy the day.
Thank you, Randy.
Thank you.
Any other administrative communications this morning? Commissioner Bueller?
I do not have anything. Thank you.
Commissioner Archer?
No, thank you.
Okay. As we come to a close in the election season, and with, at the risk of sounding like the quintessential crotchety old person who comes out and says, "Get off my lawn," political signs are not allowed in the parks. Political signs are not allowed on county property, including signs promoting municipal initiatives like a sales tax. Please do not put signs on parks, county property, including the Expo Center. Thank you. Madam Clerk, our next item.
Item 6, Executive Session.
There is a need for an executive session for consultation with an attorney for the body or agency that would be deemed privileged in the attorney-client relationship, specifically regarding a pending legal claim against Shawnee County. And this would be a motion for an executive session to be for 20 minutes with no action anticipated.
Second.
Motion made by Commissioner Cook, second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. We are in executive session for 20 minutes.
I know, I was thinking. Bill.
Executive session, no action taken. We are adjourned.
Go home.